Hello, I'm Dr. Sutter Caton, physical therapist. Today I'm going to talk to you about patellofemoral pain syndrome, more commonly known as runner's knee. So patellofemoral pain syndrome is really an umbrella term to describe any number of locations or types of pain that occur with issues in the patellofemoral joint. So in normal bending and straightening of my knee, my patella should slide and glide smoothly in what we call the femoral groove. Now, a number of things can alter this normal rhythm, and that can lead to irritation in a number of structures. It could be a bursa, it could be arthritis in the cartilage underneath the patella or in the femoral groove. But there's a large number of structures that are involved, but they all present in a somewhat similar manner. This typically presents as pain when you're going up or down stairs, have your knee bent for a long period of time, or you have pain when you're squatting. So pain from this injury can be instant, but it also more commonly occurs gradually over time. So any number of muscle imbalances can lead to this problem. So some of the more common ones, we're looking at weakness in the hip adductors or external rotators. So this leads to a little bit more of that knee caving in during exercise or when going up and down stairs. As you can see, this basically throws off, adds an increased angle and throws off where the natural movement of that patella should occur. Another problem can be overpronation at the foot and the ankle. So a similar looking situation with the leg here as my ankle caves in as we're throwing off that natural alignment. Another big area of weakness is what we call the VMO, or the vastus medialis oblique. And that's just a fancy name for the muscle, the quadricep muscle on the inner part of my thigh here. So when it's well developed, you can see it's kind of that teardrop shape here. And the main role of that muscle as it relates to the biomechanics of the patella is to help pull it medially as it glides up and down, because a lot of the tightness that we develop in the IT band or the lateral thigh will pull that patella laterally, pull it out of that groove, and that's where we can irritate the surrounding structures. So the role of that muscle is to basically counteract those forces and pull it right where it should be. Another thing we may look at is how your technique is during certain exercises. So if you're only having the pain, say when you're squatting, I'm gonna wanna look at your squat, and if I notice as you're going down, your knees collapse in, and that's the only time the pain occurs, then it might be something as simple as correcting your technique and not necessarily a long-term muscle issue that we need to worry about. So as far as diagnosing this injury, from a physical therapist's point of view, it's mostly a matter of ruling out other more serious issues and then finally coming to the conclusion of patellofemoral pain. So as always, I'm going to take a nice subjective history to get an idea of what types of symptoms the patient's experiencing and when those symptoms occur, as well as how long they've occurred. Then I'm going to do a few tests and also palpate different structures to rule out potential injuries to the ligaments, to the meniscus, or just osteoarthritis in the knee. I hope this video was informative for you. Remember, if you're having persisting knee pain or need a diagnosis, remember to go in person to your physician, physical therapist, or other healthcare professional.